Good afternoon. Welcome to the daily briefing here at the St. Clair County EMA, where we bring you the latest updates and any new numbers on the COVID-19 virus. And Sam Berman is with us today from the Health Department. And again, more numbers.
More numbers. As we have done in days past, the numbers that we will be reporting to you are St. Clair County residents that have been tested up to this point. And we are at 2,449 residents that have been tested, with 593 positive test results, which is an increase of 22 from yesterday, and that includes both males and females from their teens up to their 90s. We are at 1,807 negative test results, with 49 test results still pending. And we are at 51 deaths, which is an increase of 2 from yesterday. The first, a male in his 80s who did have underlying health conditions, and the second, a female in her 60s who also had underlying health conditions. And our thoughts and prayers go out to the families who have lost loved ones to this virus, as well as to the healthcare workers that have taken care of them. For state totals, we are at 346,286 that have been tested, 65,962 positive test results, which is an increase of 2,122 from yesterday. And we are at 2,838 deaths, which is an increase of 176 from yesterday. For hospitalization numbers, and those are for hospitals that are in St. Clair County, we are at 60 patients that are currently admitted due to COVID-related reasons, and 6 of those patients are currently on ventilators. For the congregate living facilities in St. Clair County that are currently at outbreak status, and that is 2 or more staff or residents who are either COVID positive or who have COVID-like symptoms, we have Brea of Belleville with 12 positive cases and 2 deaths, Brea of Cahokia with 5 cases and no deaths, Caritas Family Solutions in Belleville with 6 cases and no deaths, Colonnade of O'Fallon with 3 cases and no deaths, 4 Fountains in Belleville with 63 cases and 12 deaths, Help at Home in O'Fallon, which has 5 cases and no deaths, Memorial Care Center in Belleville with 43 cases and 5 deaths, St. Paul's Home in Belleville with 5 cases and 1 death, and Lebanon Care Center in Lebanon, which has 34 cases and 5 deaths. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam. So today we received guidance from the state of Illinois, at least as to the plan to reopen the state to business. The state has put 5 phases as to this virus. The first was rapid spread. The second is what they call a flattening stage, which is what we are in now. That's where it's increasing, infections are increasing at a slower rate, moving to flat or a downward trajectory. So we're in that. As we've heard, our numbers keep going up. Our hospitalizations are going up. And as we know, as we test more, our positives are going up. But really the hospitalization numbers, those ICU numbers, are the key numbers. So we'll be monitoring this with the state. I do believe that they are loosening restrictions for certain businesses where they can be assured that the public is kept safe, and we will keep you certainly abreast of that situation. The increases in our zip codes continue to exist. Only 4 zip codes today don't have any increase in them. And if you don't hear your zip code, it doesn't mean you don't have a COVID positive diagnosis in your zip code. It just means you haven't risen to the level above 5 yet. So in 62201, we remain at 13. In 62203, we are at 22. That is an increase of 2. In 62204, we now have 30. That's an increase of 3. In 62205, we have 24. That is an increase of 3. In 62206, we have 53. That is an increase of 2. In 62207, we now have 30. That is an increase of 2. In 62208, we now have 37. That is an increase of 1. In 62220, We now have 58. That's an increase of 4 COVID positive people that have been diagnosed. In 62221, we now have 45. That is an increase of 2. In 62223, we now have 36. That's an increase of 1. In 62226, we are now at 76. That's an increase of 2. In 62232, we now have 7. That's an increase of 1. In 62239, we now have 9. That's an increase of 1. In 62254, we have 18. That is an increase of 1. In 62257, we remain static at 7. In 62258, we also are stabilized at 14 for now. In 62269, we have 50. That's an increase of 1. And in 62285, we have 6. So those are the zip code reports for today. Too many of them going up. We know this number is going up. Stay home, wash your hands, wear a mask, do all those things, and we'll be able to get through this. We know we're going to get through this. We've just got to hang on for a while longer so that we're sure that when we get past this phase that we don't have to come back. We don't want to take a step backwards. We want to make sure that we're safe, that the infection is not spreading at a rate that it was, so that we can allow for the opening up of our county. Today, we're joined by Dr. Omer Bodeman. Omer is the doctor, the good doctor, is the infectious disease specialist with Memorial Hospital. We appreciate you rejoining us. I think you've been here twice before. Yes. This is number 3. Third time's the charm, doctor. After today, hopefully we're going to be on the past the flattening stage and get to the governor's recovery stage.
Yes.
So, doctor, let's talk about. We've had a rise in hospitalizations that we've seen this week. We thought things were starting to go down, but now they've risen a little bit. Can you talk to us? How are things looking in the hospital?
In the intensive care unit setting, we're seeing the number of cases decreasing. In the medical floors also, we're seeing numbers decreasing at Memorial Hospital that I can talk of. And yes, that you're going to see a little bit of up and down bumps on the test and hospitalization for a couple of reasons. Number one, as the infection rate spreads through the community, the vulnerable ones are going to be hit. So you're going to always have an admission. What you're seeing on the test is literally is a timeline that you're looking what's happening 2 weeks ago. So that's it. And number two, we're testing more people. So all that added together, you are seeing an increase in number of testing. And with that also, as the infection spreads through the community, the vulnerable people are going to get sick regardless. So you're going to see this up and down picture. But overall, from what I'm seeing, middle of April, toward the third week of April is where I was seeing very high numbers at our hospital. And in the past 2 weeks, we're beginning to almost reaching to the peak and slowly stagnating up and down in that area.
So do you attribute the fewer people in the ICU, maybe as many people in the hospital, to learning about the virus, learning about the treatment, being able to maybe keep people out of ICU that are infected?
This has been a very challenging virus, and not only to the infectious disease specialist, but for the intensivist. Initially, when the recommendations came out from experience, not data, they were saying intubate them and put them on a ventilator quicker. And they realized that's not working well, and now they're actually trying to delay putting patients on a ventilator. So all this and the little things that we do to support the patient may be helping patients to get better even before they get to the ICU. So that may be one of the things. As you can tell, hydroxychloroquine has turned out to be not the drug that we're hoping it would work for. Theoretically, there was some idea about it, but in practice it do work. We are not using it anymore in the hospital. We've been using some of the immunomodulators, that interleukin-6 blockers, which we've seen some success in very few patients. We're praying for this remdesivir to be released now that Gilead is going to be handing it over to, I think, to the U.S. government to distribute. And there is some very encouraging data that came out of the NIH concerning remdesivir. But otherwise, I think it's more of the supportive care. And my intuition is that at any time a new infection spreads through the community, as you get more and more people getting infected and living through it, then the virus has less and less place to spread. And so we're seeing less and less sicker people. So typically when you have an outbreak like this, the sicker ones come earlier on. And then later on we're seeing the more people that survived better the virus.
The milder, their cases are
Yes.
somewhat milder. Do you think you will be, or your hospital will be the recipient of some of the, I know Gilead initially donated 1.5 million doses. It takes more than one dose to get a person well. It's like 10 doses.
Yeah.
Do you think your Memorial might be getting some of that, or we just don't know?
Me and the pharmacist were on the phone today, and we were on the phone approximately 40 days ago. I wanted to be added up as a clinical investigator, and we signed for that. And eventually, when we finished all the paperwork and the process, the FDA had given the drug approval early because of some of the data that came out of the NIH. So they want now this to be as a rapid treatment. So we did ask Gilead, and I was on the phone today, and now it's at the hand of the distributors, I think, from the U.S. government. So we are waiting to be contacted, and we're hoping that we'd have at least supply to treat some of our patients who are there now.
Yeah.
The other thing that we're doing is plasma, from convalescent plasma from patients that were already infected. And with that, the American Red Cross is doing that, and we have signed up for that also as a clinical investigator. And you have to have a donor for each supply you get. And luckily, we have had at least 20 employees that have survived the COVID-19 healthy, and they have been willing to donate their blood, and at least 2 of them qualify because they have to be 28 days out from their infection. So we're hoping to get the first plasma, because there is definitely one patient in the ICU I would like to give, and we have already contacted the Red Cross, and we've already gotten the person that's going to donate the plasma.
Great. Well, that's interesting, and hopefully that comes through. So we talked earlier about the restoring Illinois' health and the fact that we're now in the flattening phase. To get to the next phase, we really have to start testing greater numbers. Can we talk a little bit about testing? What is a number? I think we've tested 2,449 people as of today in a county of 265,000 people. We need a lot more than that.
We need much more than that. Throughout the United States, our testing rate compared to other countries is much lower. And for infection prevention and epidemiology, and to really understand and start opening shops, opening stores, saying who can go to work and this, you have to have a big data, a big number that you have collected from the community, knowing who's infected. And not only that, who has been in contact with that person. So you need a combination of lot of testing and a lot of following up based on that. Some other countries like Korea or Singapore, which have been very successful in very rapidly getting the numbers down, including Germany, was that they had huge amount of testing and an army of healthcare providers that were out there tracing who was exposed from one person that tested or the other person that tested. And based on that, you can quarantine or separate those people that have tested positive, and at the same time, those who have tested negative to be out there to do what they are supposed to do, whether they are engineers or storekeepers and all that. We unfortunately are behind, so I'm kind of nervous that we are in a very uncharted territory when I say that we're ready to open up, because there is a big possibility that we may get a rebound.
So these other countries, they embarked early in manufacturing the tests. So even though they're that might not be as wealthy a country as the United States, they are wealthy in tests. We have fewer testing kits, so we're kind of at capacity right now, getting to a level of 2,500 here in St. Clair County. Is it so? And dozens of states have now reopened and said we're back in business. Missouri is one of them, and even St. Louis County, St. Louis City are still remaining kind of similar to what we're doing here. What do you do? Is it important to test people who are in a county that maybe has had one or two cases? Should they be ramping up testing, or should those test kits go to counties that have seen 593 positives like we have today and had the number of deaths that we've had?
And some countries have done it strategically. Where they have a bigger population concentration, they tested more. Where they had a smaller population out in the rural area, they tested less. I mean, if you look at the situation we're in the United States, look at New York City, which had a huge concentration of a population. That's where it spread the fastest. You look at China, Wuhan had a huge 20 million population that spread very quickly. So theoretically, if you have the test and the tests are available, yes, you test everybody. If you don't have it, then you have to be very strategic. I mean, I hate to put the comparison between the United States and Korea. Korea has a smaller population, and it's a smaller country. The United States have a much bigger population and spread over a continent, but we have big pockets of area that you could strategically press harder to test on this area. I'm glad that across the river St. Louis is holding back on that because it's a concentrated area. So I think the importance is we have to ramp up the testing, because the more tests we have and the more results we have, that would give the epidemiologist an idea exactly what we're dealing with.
Is there a percentage that an epidemiologist, you want 100, can you settle for 25% of the people being tested, which would be 50,000 people in the county plus?
I think the more you have, the better. And we're seeing about 2,500 tests. We could do much more than that.
And then what do you do with those tests? What do you extrapolate from 50,000 people being tested, finding out that the majority are probably asymptomatic?
Yes. So with this virus particularly, the thing you worry about is that in the larger population, it does not do anything. That person feels fine. They may have a day of, even some people don't even have any symptoms. I give you a great example. I had a 77-year-old that came in for a kidney stone. For unknown reason, somebody tested her. She tested positive. Her x-ray was normal. She did not have signs of pneumonia. She was not short of breath. Her main reason, she came in with fever and kidney pain, and that turned out to be. But she could be the one that's running around and exposing other people to the virus. So that's where the testing is very helpful. The more people you test, then the more you segregate them or isolate them, and then you follow up with other people she's been around with. That way, you decrease the rate of spread of this virus until either you break the chain of transmission, or the other way, most people get infected, more people get sick, and you get herd immunity, which we're hoping that would happen. But this is going to take longer to do that.
But with herd immunity, and there are a number of people that are out there saying just open everything up and let everybody get sick. If people, if they can't afford to get sick, then they should stay home. Otherwise, let us all go out. Yeah. Explain what herd immunity is, that everybody gets it, and you end up with the numbers that yes. People are immune.
Yes. So in certain infection, herd immunity plays a very important role. And those infections are people or a pathogen that does not change, typically. But a typical example is influenza. Influenza virus changes from year to year. So herd immunity is not the greatest because the year after it changes. So this is a novel virus. We don't know what it's going to do. Could it be a seasonal virus next year? It's a possibility. So yes, logic and general consensus is that once you have a new virus or an infection, most people will get a herd immunity, and then as the virus doesn't have enough people to infect, then it dies down. We don't know that about this virus. So that's the thing. And also the fact that this virus is very mild in most people. So it's very difficult to know who had the infection and who got better from it.
So name what has the country gone through before that herd immunity has worked? What particular illness?
So, chickenpox is one of them.
But you still get vaccinated for
You still get vaccinated because you can get intermittent outbreak. Herd immunity works for that period of time, so it doesn't protect you forever. Newer generation that come in that do not have exposure or have not had immunity from inherited immunity, they can have infections again, even with measles. And when we let down vaccinations rate, you get rebound, because if you have people who have not been exposed and they get exposed to it, then you do have a problem of cluster of outbreaks. That's what we have seen with measles and with pertussis.
So we know this is not the flu, but could this act like the flu? Could we have to get a COVID vaccination every year?
If I was to bet on it, this is going to be a seasonal virus. I think it's going to start behaving like the influenza virus. The good news is vaccine-wise that you mentioned, there are 102 companies that are out there working for the vaccine. And there are about 8 companies that are already on phase 1 clinical trials. So I don't think there is not going to be a vaccine. There will be a vaccine. But the time it takes to develop a vaccine for a novel virus can take from 6 to 18 months. Even with this race that's out there with 102 companies working on the vaccine, with 8 companies already doing a phase 1 clinical trial, I don't think we'll be lucky if we get a vaccine before the next winter season.
So can you just take what you would consider a typical person who contracts COVID-19 and enters your hospital? Can you just give us the progression of the typical patient? To say they started off with a cough and just say what this evolves into, to let people know the different phases that they would go through if they would contract this.
So we have 2 groups of population. The first group is somebody who typically healthier, younger, with no comorbid or illness, that come in flu-like symptom, slightly more vicious than the regular flu. One patient, I remember I told you in my last talk, he said that he felt like an influenza virus on steroids. Very, very severe pain, fever, muscle ache. They run fever from 3 to 5 days up to a week, and they feel better. That's the healthier, younger population. This is what we're talking about, the people who are sick. The second population that unfortunate ones are usually typically the elderly, diabetics, dialysis patients, typically that have asthmatics, heart disease or emphysema. They can come in initially, they can develop mild symptoms. And one group very quickly progress into much more illness and they end up in the intensive care unit or they need oxygen support. And the second group usually may get a little better and then they bounce back again, having the symptoms again, and they get worse. So these are the 2 groups that I have seen. One patient that I'm taking care of now was tested 10 days ago. She was positive. She was sent home. She was an asthmatic. And she self-quarantined herself for 7 days. She was just hanging around feeling sick. And then 2 days prior to coming, she started spiking temperatures again. Her x-rays got worse. Pneumonia got worse. And now she's in the intensive care unit. So even with the population that we're seeing, you have these 2 different dichotomies that you see that how they present.
What's the recovery rate if you end up in the ICU?
We have had good recovery rate in our ICU, and not because we have any treatment for them. It's just that there's such a great support, ventilation, and supportive care. The mortality rate can go from 2% to 49% depending how ill you are and what underlying condition you've had. I've had a dialysis patient that was in the ICU for 14 days on a ventilator, eventually came off the ventilator and he went home. And that was a very morale boost for the ICU team, because the first few cases that we've had, all we've had was death or difficulty getting them better. So yes, these patients can't do better, but the elderly population, unfortunately, we're not seeing much more success.
And that's the reason why people are being told to stay home.
Absolutely. If you see what I see in the hospital, and I'm sure a lot of doctors who take care of that will tell you, whether it's in New York or here, or in Chicago, or in China, or Italy, you really have a respect for this virus. It's very unpredictable. Most people tend to do well with it, but we have a group within our population that are extremely vulnerable, and they don't make it through this virus. So people die from this virus. So really, we have to take it very seriously, especially in the healthier, younger population who think that, I'm not going to get affected. But you could be carrying this and spreading it around to others who eventually may succumb from it.
Thank you, Dr. Herb.
Yeah, Doctor, on that same topic there, we hear people all the time saying, it's just the flu, what's the big deal? How do you respond to that?
It's not just the flu. The mortality rate with the worst influenza season we've had is about 0.9%. With this, in the health, in general, it's about 2.8 to 3%. That's 20 times more. And the influenza virus, for example, even though season to season is changed, you may have some partial antibody reactivity because it's a virus that the body knows. This is a virus that our body doesn't know at all. We had the 3 corona families that did this. The SARS, that was about 20 years ago, and the MERS, that's about, in the Middle East, about 5-6 years ago. And now we have this COVID-19. The COVID-19 is a different virus because it's very, very readily transmittable from human beings to human beings. The other 2 viruses were much harder for them to be transmitted from person to person. And number 2, that the fact that this, in 80 to 85% of the population is very silent, can make it very, very difficult to prevent the spread of this virus, because this actually may be the Achilles heel for us, because we have this security that we think, most people will do well with it, but the ones who get it and the ones who are immunocompromised or are at high risk, the mortality rate is higher. It can go up to 40%. So in the elderly population with cancer or COPD or heart disease or diabetes or kidney issue, the mortality rate is even higher than 2.8 to 3%. It can go up to 14 to 40% depending on what you are. So no, it is not the flu. Definitely is not the flu.
So the bottom line is it's more serious than the flu.
Absolutely.
So when people say that, they just really haven't done any of their research themselves, and they're just listening to other stuff out there. And I guess my other comment or question would be, you've been on our briefings here about 3 times now, and you've seen what we've been trying to do, getting the word out to our citizens to stay home. Are we on that same track? I mean, have we been doing everything that we should be doing?
Absolutely, until we have clear from higher ups that we're ready to open everything and go back to normal life. I think staying home, distancing. I was very happy that I was picking up groceries from Target this weekend. Everybody was wearing a mask. Everybody was distancing, which is very encouraging, and that's good citizenship. And I was very happy to see that. But other than that, I have seen people who sometimes are out in the streets with no mask.
And I think, Chairman, that brings a question. We had talked about the mask. Can you?
So the first time you were here, we were being advised, don't wear a mask. It's not going to help. But that was mainly because we wanted to save the masks for our first responders and for our nurses and our doctors and the people who were first priority. Now that's loosened up. More masks are available. Can you talk about the mask and who it's meant to protect, and what your chances are if one person's wearing a mask, or if both people are wearing a mask, or if none of them are wearing a mask?
So in the community setting, any form of barrier on your face will protect you from coughing and spreading that. That's the most important thing about the cloth mask, for example. That may prevent the person who has it or who's incubating it or unknowingly carrying it and who's healthy. That may prevent from him coughing up either into somebody directly or into a surface, and somebody else comes and touch that and infects themselves. So that's the least effective but effective barrier. Then you get the surgical mask, which is the yellow mask. That is good not only to prevent spread, but it also prevents you from getting it. If somebody coughs on your face and you're wearing that. Then you get the M95 mask, which are 95% protect. In the community setting, barrier protection is the most important thing, I think, which is the cloth mask or even the surgical mask would be excellent. But also cleaning your hands. You spread this thing more with your hand than anything else, because most people, they cough into a surface and then you touch it, and then the virus can survive in certain area for 3 days. So touching that and touching your face, so cleaning your hand can be as important as the mask itself. I clean my hand maybe 70, 80 times a day. Before I see a patient, after I see a patient, after I take my gloves off, I clean my hand again. Before I take my mask off, I clean my hand. When I put my mask on, it's a chore that you have to get used to doing. But in the general population, if you're out there shopping, clean your hand before you go to the store. While you're in the store, make sure you clean your cart, and when you're done shopping, clean your hand again. So hand hygiene is just as important.
And you're wearing a mask to protect others.
Absolutely.
And they're wearing a mask to protect you.
Yes. So it's a community effort, and that's if you want to. I know that there's a lot of hardship with economically because of the businesses are closed, and there are little businesses that really need to survive. We are in a very tight situation, and we have a community responsibility, but at the same time we're responsible to put bread on the table to feed our family. It's a very tough situation.
Well, I think it's worth mentioning it. It's businesses that are in problems, but the hospitals are having financial problems too because of this.
Yes.
The hospital is just as more wanting to get this thing over with than any of us are. You as a doctor, I think, wants to get it over with.
Oh, believe me, we count days. This is 53rd day from our first COVID patient in the hospital. Everybody is tired. And I can tell you that when we started this, everybody was on guard, doing everything meticulously. People get fatigued. People get tired. And when they do that, mistakes happen. And unfortunately, you hear it everywhere. Healthcare providers get infected. One of my colleagues just got infected. And he's been working tirelessly for 53 days. But we want this thing over more than anybody. I want my hospital back the way it was before, treating patients for other than fear of this unknown that's going to infect somebody.
So one last question. How do you, as the physician, the doctor, deal with this? I mean, you're living this day and night, 24 hours a day, it seems like. How do you unwind from it? I mean, do you get to take a break?
Since this has started, this COVID-19, everybody, physicians, nurses, respiratory therapists, environmental services in the hospital, administrators, everybody has been superb at being out there, taking extra work, and trying to serve the community. It's a very stressful situation. I have 4 kids. I have my wife, and I worry every day that I don't take this thing home. I never used to wear scrubs before. Things change. I wear scrubs. I had beard. I had to shave my beard because I have to make sure that the masks, everything fits. Number 1, to protect me. Number 2, to protect the patients I take care of, because it's not only the COVID-19 patients I take care of. I have other patients that I take care of that are sick. And number three, I go home at the end of the day. I have my children, I have my family, so I have to protect them. I have my community, I have relatives. Now that the churches and mosques and everything have been closed, but before we were a very close community, my neighbors. So it's a lot of burden, and it's not just the physicians and the nurses, and I think it's for the whole community. The economic stress, the fear of getting this, losing a family member, it's very, very stressful. But I think we just have to hunker down, and my feeling is that we're just around that corner, and things will change, I think.
Well, good. I like hearing that you're just around the corner. So a little bit longer. Doctor,
Yes.
we really appreciate you coming in today. I mean, I think you've answered a lot of questions, and we always look forward to you coming in and giving a good detailed report.
Thank you, Doctor, very much.
Thank you. Well, I tell you, when Dr. Bottomann's in the house, I feel a little bit better. Let's talk about on the EMA side. We had a conference call with our mayors this morning, all of them, keeping them abreast of what's going on, and we continue to do that along with our first responders, our police chiefs and fire chiefs. Just before we started the briefing today, we got a call. We'll have another shipment of the PPE coming in tomorrow. Not sure what it is, but they said it was a pretty good shipment. We've got a governor's call coming up here, a conference call. Don't forget, Chairman, at 4:30. And we talk about all of our first responders. We can't thank them enough each and every day. And in those group, we want to put a special thank out there. A young lady sent a message. The security officers on the metro trains, at the hospitals, who are directing the patients who are family members who want to try to get in and they can't. Those security officers really are stepping up and going above and beyond doing their job. You heard the numbers today, 2,121 more positive cases since yesterday, 176 deaths across the state of Illinois, 2 new ones here in St. Clair County, so those numbers go up. You heard the fine doctor saying that we're right around the corner, hopefully, but that doesn't mean we can let our guard down. We still got to keep the gas pedal going. We know it's rough, but it's rough on the doctor, it's rough on everybody. So please, hunker down, as he said, and we'll get through this. We'll be back here tomorrow at 3:30 with the next update. Be back shortly with the young ladies translating this into our Spanish communities. Thank you.